Good afternoon. Welcome everyone to today's Simple Practice Ask the Experts webinar on working with teens and adolescents. I'm Ben Caldwell. I'm the Education Director for Simple Practice Learning, and I'm honored to be joined by our expert panel today, who will answer, I think, some of the most difficult and key questions about working with teens and adolescents, particularly during this time that we've been doing so much work via telehealth. To give you a sense of kind of what the schedule will be today, we'll do introductions for the first few minutes, and we'll spend most of our time answering questions that were submitted to the panel in advance by Simple Practice customers around the country. We'll have a few minutes for final thoughts at the end, and we know many of you have exactly an hour of time here to give, so we'll make sure that we close on time, and you can get to your next appointment at 1 o'clock California time or the next hour wherever you may be. With that, let me introduce our panel. First, we have Dr. Jasmine Searcy-Pate, who is a pediatric psychologist, children's book author, and educator. Dr. Jasmine, you want to tell us a little bit about you and your work?
Absolutely. So thank you so much. Simple Practice, thank you all for being here. My name is Dr. Jasmine Searcy-Pate. Recently got married about a year ago. I am residing in Chicago, Illinois, and I am a licensed child pediatric psychologist. So I work with children as young as 3 all the way 26 years of age. I also am a children's book author and writer. I have a small practice here in Chicago, and I am a professor at Northwestern University. So thank you so much.
That's great to have you with us. Thank you, Dr. Jasmine. Next, we have Jamiko Lane, who is the clinical director for the Teen Therapy Center of Silicon Valley. Jamiko, you want to tell us about you and your work?
Yeah, thank you so much for having us. My name is Jamiko. Like you said, I'm the clinical director for the Teen Therapy Center and the Family Therapy Center of Silicon Valley. I get to work with LGBTQ teens and youth, which is a great honor, along with helping support all of my clinicians here at the practice. Super excited to be here.
Thank you so much, Jamiko. Finally, we have Lindsay Camp. Lindsay works with teens and adolescents in the Austin area as the owner of Austin Teen Therapy. Lindsay, can you tell us a little bit about you and your work?
Absolutely. Thank you, Dr. Ben. My name is Lindsay Camp again, and I want to take a moment to just acknowledge some of my identities for those of you listening along, and as these identities have shaped a lot of my experience in the world and in this work. So I'm a white woman, I'm straight assumed, and I am a settler on stolen land, and I am the owner of Austin Teen Therapy, a group practice in Austin, Texas, where we see teens and young adults and their families and their systems.
Thank you so much, Lindsay. Good to have you here. We have a handful of questions. We'll kind of go through these in order. But as we go, feel free, please, to make this a conversation. We want to make sure that we are building off of one another's expertise. And I'm a licensed family therapist myself, so I'm especially interested in hearing all that you all have to offer today. Our first question comes from Bethany, who asks, how did each of you get started in working with this population? Dr. Jasmine, I'll start with you, and then Jamiko, and then Lindsay.
Wow, that could be probably 3 hours of me explaining that, but it actually started during undergrad. I had the privilege and honor of being Miss Jackson State University, and through that platform, I created a program targeted towards mental health. I worked with a young lady who had sickle cell disease, and I found her under the stairs, about to unfortunately commit suicide with pills. I did intervene at that moment and wrote with her to the ER. And at that moment, that's when I knew I wanted to be a mental health provider in the near future. But I really didn't know as far as what I wanted to specialize. So I ended up developing a specialty and interest in pediatric health complications through pediatric psychologists. So I ended up going to grad school at Hopkins. I got my master's in counseling, and I had a great mentor during that time who said, you know what, Jasmine, I really think you have what it takes, right, to go on and pursue your doctorate in clinical psychology. And so it was through her work, and she was a woman of color from Colombia, and that was it really shaped my identity as an African American provider, but also influenced me to pursue a doctoral degree. So that's how I got started. Then through my experiences, that's how I really specialized through my internship as well as postdoctoral fellowship in child and pediatric psychology. So that's the shortened story. So.
Well, thank you. Jamiko, how about you? How'd you get started?
Well, I can't say that I have that amazing of a story, but I actually became a volunteer for the suicide crisis line here in, well, not here, but in Santa Cruz County. And I was a bartender at the time, so I took the 2 a.m. to 4 a.m. shift, and I spoke to countless teens really in crisis and at their worst and in their deepest pain. And I don't know, it was so, touching that I just felt like, you know what? This, I think, is the next step to really help teens in this way was great. It was also, traumatic, but it was fun, and it was, just a way to really engage with teens in their moment. And then when I did grad school, I had the opportunity of working with Monterey County's children behavioral health. So I got to see all kinds of different things and just loved it.
Yeah. Wow. I can't imagine what it must have been like doing that 2 a.m. shift on a crisis line. But it's I can see how it led you here. Lindsay, what about you?
Funny enough, this was not the population I thought I was working with. About 10 years ago in grad school, I thought I wanted to work with littles, and I found myself doing my practicum site at a middle school. And I was terrified. I remember middle school. I remember myself in middle school. I remember other middle schoolers. And I thought I wanted nothing to do with it. But I got there and I couldn't get enough. I love the energy of the kids. I love the developmental stage. And so for the last 10 years, that's been my focus. Yes.
Wow. Well, it's interesting to hear the diversity of experiences that led you all here. I know that for some folks, they experience working with teens and adolescents very much as like a calling, and others you sort of find your way to it after working with some other populations. So I appreciate the different pathways. Our next question comes from Caitlin, who says, what are the trainings and certifications that each of you have found helpful in your work with teens and adolescents? As a little bit of context here, we have an article on Pollen, the Simple Practice Online magazine, talking about certifications generally and saying, if they have an educational benefit for you, then by all means, but it seems like a lot of certifications don't actually carry as much weight as we might want them to with employers or prospective clients. And so certainly talk about certifications, but also particular elements of training. What have you found most impactful, most helpful in your work with this population? And Jamiko, I'll start with you, and then Lindsay and Jasmine.
I love this question. And as the clinical director, I'm always looking for trainings for my team and trying to figure out ways to help my team build up their skill set. My biggest help, I think, with working with teens, and I feel like anyone who works with teens, be it a teacher or a doctor or a therapist, is an expert at motivational interviewing. I feel like that is like your key buy-in on how to get kids involved and engaged and really connect with them. Personally, I'm Team CBT certified. It's a training through David Burns, and I love it. I love CBT as a means to really connect intellectually with kids and just kind of lay it out there with, hey, this is your thought, this is what we're doing, making it simple. And then, I think just as a general rule, just really practicing your person-centered therapy to be able to just be grounded and genuine with kids. I find that to be the helpful things. I've had trainings in DBT and, all the acronyms, I feel like. And I feel like I do grab a little bit from each of them, but those are the two that I really pull the most from.
Great, thank you. Lindsay, what about you?
Yeah, I have found, I'm only technically certified as I'm EMDR trained, and that's probably the only thing I could put as letters after my name, but I've really found that eating disorder training, specifically from a social justice and body liberation standpoint, is most important given the kind of the world that we live in. We're obsessed with diets, we're obsessed with, shrinking people's bodies and oppressing different populations. And so really digging into some eating disorder training has been phenomenal for me. I don't name that I'm an eating disorder therapist, but I can't help but be an eating disorder therapist because so many of our clients come in with complicated relationships with food and bodies. And so that's one that I feel is just extra important for this population.
Yeah, that makes a lot of sense. Dr. Jasmine, what about you?
Absolutely. So I'm hearing training, certifications. I think all of them. I take more of an eclectic approach. So obviously I work with the full gamut, so I can see children as young as 9 months old, if it depends what I'm doing, and I'm implementing TheraPlay, and I can see an adult as young as old as 26, and I'm using trauma-focused CBT, motivational interviewing, DBT, EMDR, the whole gamut, right? And I think the one thing, and I'm thinking of more of a professor mindset and training and when I'm supervising, that once you get these certifications, whether it's motivational interviewing, whatever it is you choose for the populations that you're choosing, that you're getting that supervision, right? So if you go to the David Beck Institute, if you're going to get your trauma-focused CBT certification or EMDR, the thing is to have a great background with cognitive behavioral therapy and getting that supervision. And that's just not one case. I would say someone is really called an expert or having the experience if you've had at least 10 exposures, right? Or being able to really implement that with patients or families that you're working with. I think I agree with Jamiko, having a great background in motivational interviewing when we think about teens and adolescents, and that's if they're cognitively there, because obviously sometimes we're working with teens who may be socially or emotionally younger. But if you're working with teens and adolescents, motivational interviewing, definitely important, and being grounded in cognitive behavioral therapy will be a great benefit for moving forward to the bigger modalities. And so that's what I wanted to add. And of course, you can do that through Simple Practice. I'm putting a plug in. The Beck, David Beck Institute, you have PESI, you have so many things, right? The most important at the end of the day, get the training, get the supervision that you need from your organizations before you say you're an expert in that modality. So.
Well, you raise this really interesting point, and we're talking about the pathways that led you here, as well as the various trainings and certifications and that kind of thing. But I'm curious, maybe a little more broadly speaking, what do you feel like it is about you and your life or your personality or whatever it might be that really best prepared you for this work? And part of the reason why I ask is, Lindsay, you were talking about this experience of being terrified of middle schoolers and not wanting to go back to that. And I think for a lot of clinicians, they probably have that same kind of memory of what middle school would be like, and the same kind of fear of working with kids. I even remember there was a journal article, and this is going back a while now, but there was a journal article in one of the family therapy journals making a data-driven argument that children are often excluded from family therapy, even when clinical indicators suggest that they should be included. So all of this to say, for clinicians who are hesitant or afraid of working with kids, working with adolescents, what is it about you or your life or your personality, whatever it may be, that you feel like made you ready to do this work? And Dr. Jasmine, I'll start here with you.
Yeah, I think that's a great question because, obviously when we're all in training, especially when you're working with the little ones as young as 3, they're asking you, and sometimes teens, why is your hair like that? Or did you paint on your eyebrows? They're very transparent, right? And you really have to not necessarily come up with the right responses, but be present in the moment. So I find that being genuine, being open, being authentic, right? Going with the flow, right? So when I was in training, I had this rigid approach. I have to do A, B, C, D. And actually in my practice, I had to really start to be flexible with where the sessions would go, still have in the back of my mind the goals, right? But if it didn't start at the table doing this exercise, be okay with it. And I think that has been helpful and more of a a curious approach as well in my practice. So that has worked for me. So.
Yeah, that makes sense. Lindsay, let me go to you here because you had talked about that experience of being terrified of middle schoolers, which I'm sure you're not alone in that. What was it that in your mind kind of made you ready, made you a good fit for this kind of work?
I love this question so much. I think that I had to go back and meet my inner child. I had to go back and spend some time with middle school me and high school me and young adult me to get prepared for it. And when I could do that, when I could access her, when I could give her some compassion and some safety, then I could come to my teens with that as well. That being able to remember what it was like was actually a benefit, as scary as it was at times. But being able to put myself back in those shoes of everything is new, everything is big, everything is scary, has been a huge asset to me in this work that I take my teens very serious. I believe them and I advocate for them, and I think that that's important.
Yeah, I think so. I mean, I'm certainly not an expert in this area, but the folks I know who are clinicians who work with adolescents talk a lot about how often teenagers are just sort of dismissed by the world around them. They're not taken seriously. Jamiko, what about you? What made you a good fit for this work?
I feel like the universe just kind of threw me into it. So I feel like, that's a part of it as well, right? Like as a Christian, I feel like you're led to where you're supposed to be. And, I can vividly remember my first client not having any prep, just being like, okay, you're starting, here you go. And being like, well, what am I supposed to do? And this poor kid just thought I was a joke and was just like, nope, no, thank you. And I realized because I was so nervous, right? Like I was just so nervous and I had to be this perfect therapist and I had to, here are all my interventions. And I was just like, man, I feel like, I think if I just am real, like Dr. Jasmine said, right? Like if I feel like I'm real, I can do that. And so the moment I've kind of settled into myself and found that genuine, authentic self, I felt like then I was ready. And then I was able to connect. And then it just became easy, right? And I feel like that ability is great, right? And so I feel like I've gotten some clients who kind of led me down a different path and, going this way and that way. And yet every time I think back, I'm like, okay, you know what? We're gonna roll with it. This is what I'm gonna get. This is what is gonna work. So I feel like
I wanted to add, that was really good if it's okay, Dr. Ben. Yes, Lindsay said something too, and Jamiko. I do like to take a trauma-informed approach, the safety, especially working, well, children, period, but necessarily teens, because when they're coming, and I don't know about when you're working with teens, sometimes teens, they're not open to that therapeutic alliance, right? Because they know sometimes parents, they want them in session, right? And so when they meet me, they sometimes have this resistance, right? And so we have the motivational interviewing, but I have to, when I sense or say you're in a safe place, this is your safe space, let's kick mom or dad out right now, let's get to know each other. I do feel a sense that the teams that I work with, they kind of ease and then they start to open up, just creating that safety piece. That's all I wanted to add. So.
Yeah, that's a great point. And it leads nicely into our next question. It comes from Cherie, who asks, what modalities work best for working with teens and adolescents? And I think each of you have answered this a little bit already. So I'm going to try to make it a little more specific and talk about our current telehealth-based world. But one of the big challenges in therapy with adolescents generally is maintaining engagement. That's a particular problem when you're trying to do therapy via telehealth. And if they get bored or irritated with you or whatever, they can just close the computer and walk off, right?
Yes.
So how have you been keeping your adolescent clients engaged during this really challenging time? Lindsay, I'll start with you, and then Dr. Jasmine, and then Jamiko.
I think I'm in a unique position that I haven't taken on too many new clients during COVID. And so there are only a few that I have never seen their legs or their lower half of their body. Most of my clients that I've been working with, I knew them for a long time prior to COVID. So I think my answer might be different if I had a huge caseload with COVID. But a lot of my work is very framed by some somatic practice and narrative therapy and IFS and feminist theory, and all of that translates really well to the screen as is. I used to do a lot of like art and activities in my work, and we can do that too still, but the work that I have been doing has worked for telehealth too, and that's been actually kind of a huge gift. And then when there's that resistance, when there's that that the way that they don't want to be there, I roll with that too, and can use that as an opportunity to build rapport, to say, okay, cool, like if you don't want to be here, that's okay, you don't have to. And so that is a trust building exercise as well. So for clients that are disengaged, they truly don't want to be in therapy, I don't force it. I tell the parents that it's counterproductive, and we go our separate ways, door always open. But for the ones that do want to be there, the usual modalities seem to be working really well for me.
Yeah, makes sense. Dr. Jasmine?
Yeah, I'm listening to Lindsay, and that was actually a good point. When I think about teens and even this virtual format, first thing I think about is Erik Erikson's stages of development. So I'm thinking teens are in that role, who am I versus role confusion, but also thinking about offering them choices, and choice and that autonomy is very important. So oftentimes, and I'm thinking about my own work, I have to implement creative things. So most of my practice, specifically with teens, or teens who have chronic medical conditions, difficulties with pain management, anxiety, or executive functioning challenges, I found that I've had to use things like the virtual background, right, of a cloud, right? I've had to open the session up with grandpa jokes or granddad jokes, where I'm starting off with a joke to kind of loosen teens up, or we're doing a dance to Kids Bop or whatnot to really break the ice and build that rapport before we start our session. Most of the interventions that I obviously, and I'm sorry, I'm going to stand up, sorry about that. Most of the interventions that I really pull from is ACT, which is acceptance and commitment therapy, mindfulness. I do yoga with my teens, which they really love, especially the ones who are female and male, some of my males too. Cognitive behavioral therapy. More of my trauma work is going to be in session, but when I'm implementing those modalities virtually, I do, like Lindsay said, I give them choice, right? So today, here are the goals. We're going to get to the serious thing first after our icebreaker. And then what should we do with the latter part of our session, right? So some teens may say, I'm kind of done, I got homework to do, right? Or I'm not really feeling it, I'd rather be in the office with you. And for whatever reason, we're meeting virtually, I let them have that choice and I go with it, right? Instead of meeting an hour, maybe just 30 minutes or even 45 minutes. It's really going with the flow of things. So that typically works for me. So
I would imagine a lot more adolescents would come to therapy if they knew that it started with either a good joke or a dance party.
yes, and they love it. Yes, the virtual backgrounds, my teens love it. Even if we're doing the guided imagery, so if we're doing yoga, I'll change it and they'll change their backgrounds, and we're starting like a grounding exercise or their favorite place using 5 senses, and they love it. Or even my lame grandpa jokes, they like that too. And then we'll exchange, and I'm like, okay, I'm done for today, so absolutely. So
Well, Jamika, what about you?
Well, I love hearing all of these things. I think they're all great. Thank you. So part of my therapy process is implementing testing at the very beginning, which is called the brief mood survey. So it really allows me to see, like, here's a snapshot of how I'm feeling. And so they give me this information ahead of time. So I know, like, okay, this is where we're going. Sometimes my teens are like, I don't want to do that, Jamika, it's just homework. Sometimes they're really into it and they can navigate their own emotions. How am I feeling? What did upset me today? So I love using that. I think that has really helped keep kids engaged. Along with, sometimes my biggest therapeutic intervention virtually is to stop doing therapy, is to really allow just the space of, how's it going? Spill the tea. What's going on? Tell me what's new with you. And just allowing them to connect and just have a space, because truly with the virtual world, they have just so much going on. They don't ever really get one-on-one interactions, let alone one-on-one interactions with adults, because in the Silicon Valley, most parents are both working and working long hours, so you don't really have a lot of interaction. And so just to be that consistent adult, I think has made it really accessible to then work into the deep stuff and really get into kind of the nitty gritty, because they know like it doesn't always have to be heavy with me. I'm real sarcastic. I know a lot about a lot of things. I know more about Fortnite than I ever thought I would. So we can talk about anything you want. And, there are going to be times where I'm going to ask you the tough questions. And so I try to use a lot of humor. And I will say letting them share their screen has just made a big difference, to let them be like, look at this art I'm doing, or look at this cool game I just played, or here, I have this meme I want to show you. It lets them be empowered and be really bought into therapy.
Yes, I was going to add that was really good. A safe space, especially my teens are like, oh, doctors, I got to tell you this is what I did. Okay, you're not going to tell my mom, and I'm like, okay. And sometimes if it's roadblocks or they'll share their screen and I'm looking, but I'm also scanning to make sure that it's appropriate what they have on their social media. So I'm adding to Jamiko when I say that. So good. Yeah.
Yeah, it sounds like what all of your answers have in common is that you're giving your adolescent clients a measure of really control of the session. So they don't have the experience of therapy as something that they subject themselves to, but rather something that they are an active participant in and really have some say over. Is that fair?
Mm-hmm.
Yeah. Definitely. In grad school, I was taught that teens are given 800 directives a day. Stand up, sit down, go to class, do your homework, whatever. And so I share with my families, my teens, and just my parents alone, like sometimes they just need choice. They need advocacy in themselves. So I don't often let my kids be like, nope, we're not going to do therapy today. Like, I'll be like, no, we're just going to sit here. That's cool. But you get to see what you want to talk about. That's their choice. And to really let them know that life isn't about being told what to do every single minute of the day. You do get to build into an adult, which we have to make those decisions. And sometimes those decisions are scary. And that leads into anxiety in kids because they're not given enough opportunity to make choice. And so I try to make our hour or 75 minutes to, allow them for that, moment of adulting, as I call it.
Mm-hmm. And to add to Jamiko, sometimes I ask parents, which then they back down. I'm like, I'm curious to know, how were you like when you were Jasmine's age? And then that's when they'll look up and reflect and kind of, yeah, you're right. Trying to kind of reflect, because I have to remind them that when they say, but they've been in session. I mean, what do they talk about, right? And they're focused on goals, and really, we want to be flexible. So that was good. Yeah, just wanted to add that.
That's a really nice segue, because our next question here from Ashley is, how important is it for the parent of the teen and adolescent to see a therapist through this process? And I guess we could read that one of two ways. We could either read that as, to be involved in some way in regular communication with the adolescent's therapist, or for the parent to actually have their own therapeutic space, whether individually or in a couple context with the other parent, if there is another parent or guardian in the home. How important is that in your eyes? And Dr. Jasmine, I'll start with you, and then Jamiko, and then Lindsay.
Right. So I know all of us are in separate states right now. So I am in Illinois, Chicago, Illinois. It will differ, because currently I'm a Psych Pack member, which is now I'm licensed in an additional 34 states. So it's different, and I really have to, get myself and really know those laws. But in the state of Illinois, if you're 12 and up, you can actually go see a mental health provider at least 7 times without your parents knowing, even if there are safety concerns. Obviously, I will be the provider to get that child, but it really depends what the referral question is, right? So I have families who are interested in family therapy when they come see me, if the kids are 12 and up. And then I have some who just want Jasmine to come to sessions to learn anxiety management, pain management. So it it really depends on the referral question. After assessment, usually I meet with families 2 or 3 times to give assessments to the teen to determine not only what's good, what are they reporting, what am I seeing on the assessments, and what I'm hearing to really conceptualize what the treatment goals would be. And really that's what determines it, right? So if I found out through my assessment or evaluation that, okay, these sessions are really just Jasmine sessions, I do follow up with parents either at the beginning or the end of the sessions about the treatment goals, right? Not the nitty gritty of what has been discussed, but what are the things relevant to the treatment plan that we have accomplished, right? And so the privilege is really the teen or the pre-adolescent, unless there are safety concerns. And the safety concerns obviously is self-harm, abusing drugs and alcohol. In the state of Illinois, marijuana is legal right now, right? Obviously, teens are not, they can't use it, but I have some teens who do, right? So we have to discuss that fine line and what includes confidentiality. Now, if it deems that, hey, therapy is for the whole family, then I work with the whole family, right? And obviously everything is separate, but in this state, 12 and up, you actually have that confidentiality. So unless there's a safety concern, I'm not spilling the beans. Now, it doesn't mean that I won't say, hey, Jasmine, I've noticed you say you've smoked marijuana every day and you're using cocaine or heroin. I think this is really something because I see that it's affecting you. I think we should really talk to mom and dad about this, right? So I can have those conversations, but unfortunately the confidentiality is kept to the minor. So, yeah.
Yeah, that makes sense. And as you're saying, the rules are going to be different from one state to the next, especially as it relates to, when do you need parental consent versus non-consent? What sorts of things do you sort of have permission encoded in the law to break confidentiality for versus not? Jamiko, what about the more clinical?
I was going to say this. When it comes to different licenses, this is my bottom line. Consult your malpractice, consult your lawyer. The bottom line, okay? Consult your degree, your license when it comes to issues like that. If you have a question, because we can go 3 to 5 hours or more with this conversation, but I want to just put that disclaimer out there. So sorry about that.
Yeah, absolutely. That's a great point. If there are questions about your particular situation about, how confidentiality applies to you or in a particular case, of course, it's going to be a good idea to consult with an attorney, especially one provided through your professional liability insurance, because they're the ones who would be defending you if there's some kind of a complaint or a court case. Jamiko, what about the sort of clinical aspect here in terms of, do parents need to be in some form of therapy themselves if they've got an adolescent who is engaging in the therapy process?
Yes. So I would like to answer kind of the both questions, if that's okay. So here at the Teen Therapy Center, we actually involve our parents monthly. We check in with our parents once a month and really let them know how progress is going. And I'm a huge proponent in that because we need to understand what's happening at home. We only get to see them for 50 to 75 minutes a week. We need to know what actually is going on, right? Because we only know as much as the teen is telling us, and sometimes that's not the truth, right? And to really help teens gain insight and perspective.
Wait a minute, what?
Yes, that's what yes. So to help us gain insight and to make sure we don't have this tunnel vision of really just joining with our clients, to make sure there's a bigger perspective. We're really all about making that well known. We let them know at the very beginning of the intake and letting them know that, hey, we're not going to spill the beans. We're not going to tell them what's going on. We really just want to understand and gather more information. But I will say that to answer your second question, Ben, that most of my kids are the IPs, right? The identified patient. And that's heartbreaking to me, right? To think that, oh, I'm the only reason that our family is fighting, or I'm the only reason that I'm failing. I think that's hard. We here at the Teen Therapy Center, we provide parent support. So sometimes that's a therapeutic unit of how do you parent your child, right? Sometimes that's different than individual therapy because maybe you've worked through all your stuff. Maybe you've done your work and really healed, but sometimes it's hard. You don't know what it's like to be a teen in 2021. You have no idea. And to assume you do is just a little bit asinine. So sometimes you need help, right? We're doing the best we can with what we have, and sometimes that needs a little bit of support. Also, sometimes you just need personal support because you're being triggered, right? Maybe they're in a stage of life where your trauma happened and they're saying or doing things that are triggering wounds in you that need to be addressed. And so I think really modeling for your teen, if you want your teen to be invested in therapy, you also need to be invested in therapy, because modeling is by far the best tool for change in a child. And so I feel like, yes, I think it's so important for not only the parent to be involved in the teen's process, but for the parent to be involved in their own process. I think it's just the healthy kind of circle of life.
Lindsay, what about you? You agree?
Yeah, I'm thinking about how teachers, when you ask a teacher if they like their job, they say, "Oh my gosh, yes, like I love my students," but who, the parents, like that's the answer. And
Yes.
the answer for clinicians who work with teens, like we love the clients we work with, we love them, love them, love them, and the parents can be a lot. And so whether it's parents that are being a lot or just regular parents, I do advocate for them to have their own place, their own therapist. I myself am going to be in therapy for as long as I live, so I just see the benefit. And like my colleagues are saying, there is so much that can be done in tandem. And I usually tell the parents, like, you'll get more bang for your buck if you're also doing your work, if you also have somebody to talk to. This just all feeds off each other. So I'm a huge proponent of parents being in therapy. Absolutely.
Yeah, it does seem like the more perspectives we get of what's happening in the family, the more we can start to put puzzle pieces together. I mentioned I'm licensed as an MFT. I don't specialize in working with adolescents, but I've worked with a number of families. I've got a lot of colleagues who do more of that kind of work. And it seems like it's amazing how often you'll have a teenager come in, and teenager appears to be in distress, is the IP, is displaying a lot of problematic behaviors. And then as you get to know the parents and you get to know the family dynamics, then you're like, oh, I get it now. I see where this comes from. I see how this happens.
Yes, absolutely. And that's where, I'm with Lindsay and Jamiko. I'm like, okay, mom or dad, do you need your own separate? Then you need a whole family component, right? And then the teen. And then I do have some parents where I'm like, I don't even know if at this point it's conducive to involve the parent just yet. We got to explore this first before we get to this, So it's, it's a tricky situation, right? So.
Yeah, for sure. There's a lot of complexity involved. Our next question comes from Brian, who asks, when getting started with teens, what are best practices when dealing with confidentiality, and what must be shared with parents? I want to go back to what we were saying earlier, that the legal stuff is going to vary from one state to another. So rather than focusing on the legal stuff, I'm more interested in how each of you handles this clinically. I would imagine if you've got family where the family is providing consent on behalf of the teenager, you have to kind of work out with them what information are you going to share, regardless of, you maybe can share a lot because you've got permission from everybody involved, but what are you actually going to share from that teenager session with the parents? Jamiko, I'll start with you, and then Lindsay, and then Jasmine.
I think I let my kids know that confidentiality is my bread and butter, right? It's the reason you're coming to therapy. This is the safe space that you have. So I take it very seriously. I also let the parents and the kid at the same time know about my rules of the room, which is just my way of saying the limits to confidentiality. And so I make it very clear, everyone understands, and we're all on the same page. When it comes though to like talking with parents and sharing, I actually just check in with the kid first. Like, hey, it's time for me to check in with your mom. What are we talking about? What don't you want me to talk about? What are things that you want addressed? And that gives me an opportunity to see where the kid is at, and also to bring up the rules of the room again, but also to let them know, like, hey, actually, that would be good for you to talk to your parent about. Let's go ahead and just bring them into session as opposed to me talking about that. And so sometimes that's the easiest way to navigate this, is just to bring everyone in the room together. But I love my kids are really open. Like, I want you to share this. I don't want you to share that. Can you wait maybe a week? Right? Like, they have a lot of opinion about it. So I do really like strongly hold my confidentiality. And sometimes it's hard because parents will ask lots of questions. They'll be like, well, that is information I am not at liberty to discuss, but I'm more than happy to get more information from you. Right. And parents really, as a general rule, take it to heart and understand. And one of my things as well is to build rapport with the parents so you can connect with them. And so they have a sense of trust with you, that you're holding space for their teen in a way that's safe and really guided towards everyone's on the same page and holding that child in regard.
Lindsay, how do you make that balance? How do you decide what's going to get shared and what's not?
Absolutely. Jamiko, I love your language, rules of the room. I'm gonna borrow that. I love that.
Yeah.
So I go over the limits of confidentiality in the first session, and I basically say my little spiel about there's the black and white stuff, and then there's the gray. And the black and white stuff is, safety concerns and things like that we all know. And I'll go through it, and I'll also tell the kids, I will ask you if you want to be present for that conversation or not. What you want me to modify about that and things like that. So I'm holding a really firm boundary, but I'm giving as much choice as I possibly can. And in front of the parent and the teen, I basically say, I'm not a hired spy. My teen will never leave here. And I type up an email to mom and dad, like, or mom and mom or whoever, like, oh, this is what they said today. Like, that's BS. And it would be a waste of everybody's time and money. And so in front of both teen and parent, I say that. And then when we talk about the gray stuff, again, kind of like Jamiko said, I'll say, hey, that seems like something parent would, it might be important for parents to know that. Are you open to that? And again, anytime a parent sends me an email, gives me a call, I remind them, let me talk to my team, your team, and we'll go from there. So we're holding that boundary as much as possible and giving so much choice whenever we possibly can.
Yeah. Dr. Jasmine?
No, those are great. I think one of my colleagues said trust, building the rapport is very important when you're thinking about confidentiality and these issues. And I want to echo that I typically do what both of my colleagues when I meet families. At the beginning, I'm talking about confidentiality, and those safety concerns are gray areas that will warrant for me to obviously disclose that to Jasmine's families, mom and dad. I'm happy that I don't have parents who reach out to me via email because they already know. So that's a great thing. But I think if you focus on the rapport, the relationship, the trust, right, that will be good. But once I talk about the confidentiality with the parents and the team together, me and the team, we meet and we kind of come up with a scaling system from 1 to 10. So 1 is the least, 10 is, oh, that's a safety concern, right? And I actually have that in my office on a wall, right, for us to kind of talk about as things come up, right? So obviously, the 10s are obviously if you're cutting or if you're having suicidal ideation, or those definitely 9 to 10 areas. But we also have the 1s through 7. And me and the team, we kind of come up with a number where it warrants for us to kind of bring it up together, right? Or separately to the parents, right? And so most of my teams are pretty open with that. So if they say, hey, I was smoking marijuana every day this week, okay, or I cheated on the test, the ACT or whatever has happened, once a rapport, we talk about it, but it's also something where I'm like, I'm curious, or I'm wondering what number this should be. And should we bring this up to mom and dad? Because I think this will be helpful in these ways, right? And oftentimes teams agree to that, and they know at the end of the day, I'm their advocate, right? So they use me to voice if they're not able to. I'm that person, I'm that go-to, I'm right here with you so that we can process this together, right? And so that typically works out when it comes to confidentiality, but the scaling and having like a little temperature, either a temperature or scale, that helps mostly with my team, so. Yep.
I really like that idea of having the scale that you can determine alongside that adolescent. How far up this scale does it need to be before we share it? I think that's a really cool idea.
And I was going to add,
here.
Yeah.
No, sorry, go ahead.
Okay, I was going to add one more thing. You know, we all work with teens, and teens, this is the impulsivity. They're trying things out, right? During that first and second session after the scaling, I asked the parents and the team together, what are the things outside of cutting, outside of the known safety concerns, the things that absolutely we need to bring up? So some parents may say, hey, if my child is having sex, right? Or if they're doing drugs or doing the parents, and we have to agree on that, right? In that aspect, right? And ways that we would talk about that together should that come up. So that's something else that I do to kind of close that loop too. So, yeah, sorry. Mm-hmm.
So we've addressed a couple of the other questions on here. I wanted to skip us ahead to question 9 from Catherine. What are current thoughts and best practices regarding teens' social media use and mental health? This is an area that has gotten more complicated, I think, in terms of the underlying research over the past few years, where the relationship between social media use and mental health is a thing. There is a relationship there, but it's proving to be more complicated than I think a lot of us initially thought. So how do you kind of work with this with your adolescents? How do you parse out when social media is a problem versus when it's neutral versus when it's potentially beneficial? Lindsay, I'll start with you, and then Dr. Jasmine, and then Jamika.
Oh gosh, there's so much here. There's so much here. Two things are coming up for me. One is kind of the advice that was laid out in The Social Dilemma, which if you haven't seen it, I highly recommend. And the advice there being that one, get phones and tablet screens out of kids' rooms at night as a boundary, and then push social media as far out as you can. Their recommendation is high school of 16. That's a tough piece. And then also having some boundaries about the time and having a collaborative conversation about how much time do you think you need or want on social media, and having a back and forth discussion about that. The other piece of it that's coming to my mind is this idea that our social media is a space that we occupy, much like our homes, our rooms, and we like that space to feel good for us. And so I wouldn't decorate my room with posters of things that triggered me or upset me. And similarly, in the space that we occupy online, if there are things that you notice you're online and it doesn't feel good and you're thinking about, you know, comparisons and things like that, then maybe it's time to clean up that space and make it a space that isn't triggering. And so those are kind of the two things that come to my mind when I think about social media and teens, is the boundaries that are needed, and then also the mindfulness and the intention behind it that's needed.
Yeah, I really like that analogy of treating it as a space that you occupy. Dr. Jasmine, what would you add?
Yeah, it is tricky. It's like the social media has been like the Me Too movement. Like, Jasmine, or I found out I had ADHD or depression or anxiety because I saw this through this, and it's like everything is a connection here. And meeting my teens, the boundaries, like Lindsay said, is very important, right? Unfortunately, a lot of my teens, and I'm not sure about you all, by the time they're 9 or 10, they've already been introduced to TikTok, all of these social media outlets, Roblox. I have literally met a teen who lived the virtual world and was connecting with her peers through this. All of them were sitting at the table in Roblox in their world, talking about depression through chats and cutting and all of that. So that's the reality, right? And feeling connected. However, I'm gonna go back to Lindsay's point. When I talk to teens, I do say, hey, I'm wondering, does this trigger you? So you're in therapy now, you're learning skills, but then when we go back to this world, whether it's Roblox, TikTok, peer exchange, wherever you're connecting, are you triggered to cut? Are you triggered or having these ideations that you shouldn't be having? And it kind of increased, right, by going back to this place. And so I have those discussions, and we weigh out the pros and cons through cognitive behavioral therapy, right, or interventions to kind of explore, hey, let's do an analysis here. Is it beneficial? Should we cut back? what's realistic here, right? So that we won't compare, so that we won't be triggered in any ways, right? So it's a tricky thing. It's like a pro, but then it's a con of things, right? And so I've seen the whole gamut when working with teens in this population. So that's what I want to say.
I can imagine. And Jamiko, I would imagine that you have as well.
Yeah, I mean, I'll have to echo what both Dr. Jasmine and Lindsay said. I think there are just so many benefits to it though, right? Like it's when you're in school, you have Instagram chats or Snapchat chats to connect on school projects and homework and things like that. So how can you take it away from kids, right? I still don't understand why kids just don't text, but that's beyond me.
Yeah.
So it's just so weird to me. But so there are so many benefits to it. It also allows them to find passion and to use it as a platform for their passions and interests and their art and their the things that they want to do, right? So there are very good things about it, especially virtually. How else did our kids stay connected when you literally couldn't see people face to face? So I'm a huge proponent of social media. I'm also a huge proponent of curating your social media. And Lindsay, I'm gonna have to steal that from you, the analogy of like decorating your room, because it's true. I work with a lot of kids who struggle with disordered eating because in the queer community, it's a big thing. And so how do you find people that are going to lift you up? How are you going to find people who are motivating and mentors to you? It's not any different than affirmations, right? Like, why would you speak to yourself that way? If you're gonna spend 4 hours on social media, can you at least make it beneficial, right? Because there are benefits to it, and a learning platform, and just to allow them to understand, can you live without it, right? Like, can I challenge you to spend 2 hours and not be on your phone? How does that feel? What is that like? What do you do to replace it? Just to allow that decrease in need for instant gratification, right? That those likes and those things for validation, and really connecting it for them to allow them external motivation and validation versus internal. And how do you change that? How do you change the story and the script of what you're seeing? Because it's not going away. Our kids have literally lived with social media their entire lives. We haven't, right? We know how, well, maybe we don't know how to, but I will assume we know how to live without it. They don't, right? Like literally it's been around for 18, 21 years, some of them. And so you got to embrace it and really see the positives of it. And, like Lindsay said, I'm a huge proponent of not having a TV even in your room because it does mess with your sleep. So if it's possible, but everyone has to do it. It can't just be the kids. It has to be the parents too. We're going to all check in our cell phones, right? It has to be a whole family unit thing.
Yeah, that's fantastic. And you mentioned earlier about how parents today don't know what it's like to be a teenager in 2021, and this is a great example, right? When we were teenagers, this was not part of our experience, certainly not in the same way. So I want to thank each of you again. I'll give you the opportunity for some final thoughts here in a second. First, wanted to mention for folks who are interested in learning more about the current complex research about how social media and mental health interact, we're doing our first Simple Practice Learning live event on September 17th at 11:30 a.m. Pacific on social media and mental health. That's with Alexander Chris, a psychologist who specializes in this area. More information on that event, which does provide 1.5 hours of CE for those who qualify under the approvals that we hold. More information on that event is available at simplepracticelearning.com. Before we call it a day here, wanted to give each of you an opportunity for a final thought, and also if you could include, for folks who want to know more about you or connect with you, what's the best way for them to do that? Lindsay, I'll start with you, then Dr. Jasmine, then Jamiko.
Absolutely. Thank you all so much for sharing this space together. And this was really wonderful. I love encouraging folks to work with teens. I think so many people are scared of it like I was, and it's really rewarding work. So I hope this was helpful. As some final thoughts, to follow me on my Instagram at austinteentherapy.com, and also sign up for our mailing list where we will be, we're going to be launching some trainings. And so specifically trainings for working with teens and their families, the people that care for them. So go on my Instagram or my website, www.austinteentherapy.com, and sign up for our mailing list there.
Thank you so much, Lindsay. Dr. Jasmine.
Yes. So again, to echo my colleagues, thank you so much for joining us for this hour of conversation. You can also follow me on Instagram at Circe_pediatrics, or you can visit me at circepediatrics.org to find out more about what I do, including I have a children's book out called Olivia Takes a Mental Health Day, just to normalize mental health in specifically BIPOC communities, so communities of color, and also have a retail line that affirms mental health in youth called Young, Gifted, and Mentally Well, to change the narrative of mental health and what it means to be whole from a holistic perspective. My final thoughts is get the trainings, reach out to each of us if you want to consult or if you just have questions, okay? And just enjoy your day. So thank you.
Thank you so much, Dr. Jasmine. Jamiko?
Once again, thank you everyone for joining, and thank you, Dr. Caldwell, for facilitating the conversation. We appreciate it. I think I'll start with my final thoughts. Teenagers aren't as scary as everyone says they are, as long as you can be yourself, right? Be genuine, be authentic, be direct. They don't really like when you beat around the bush. They think you have an agenda. Make sure you come to session without the agenda and let them lead the room. Also, if you're funny, that helps. So I'm just saying, those are things to have as a therapist. But yes, try it, get some certifications, do some role plays with people. I think those are also really great when you're if you don't have supervision because you're licensed, find a consult group that you can do some role plays, really connect with people. If you'd like to connect with me, you can look on our website. It's Teen Therapy Center SV for Silicon Valley.com. And so we would love to, I'm sure all of us would love to help if you have any questions.
Well, thank you all again so much. Really appreciate your time, your wisdom, your expertise. This is a wonderful hour. I'm very grateful to each of you. On behalf of all of us at Simple Practice, to everyone in attendance, thank you so much for your time as well today. I'm Ben Caldwell, and on behalf of all of us, have a wonderful rest of your day. We hope to see you soon. Take care.
Bye.